Hi.
My name is Dr. Ackham.
I'm Lenny.
Nice to meet you.
I'm Lenny's father.
All right. What brings you in today?
Well, doctor, I haven't been feeling the greatest, and I'm not really sure why. So I've been having a lot of really bad headaches, and my joints have been really achy, which is weird because I'm 12.
Yeah.
And
Flies.
yeah. What else would I have?
Oh, tell her about your rash.
Oh yeah, the rash. So I've had this weird rash for a while now.
Yeah. Wow. Look at that.
I just showed up a couple days ago, kind of out of nowhere.
Yeah.
Okay. Lenny, I think you may have Lyme's disease. Just by seeing that bullseye rash, that's pretty characteristic of the disease. Have you been camping recently, or been outdoors running through some long grass or anything like that?
Yeah, come to think about it, we were up at Lymes a couple days ago, and yeah, we were just going through the woods, and I don't know, maybe I don't know.
Is that a big mosquito bite or what?
Well, it looks like this actually came from a tick. So Lyme's disease is going to be transferred to humans by the bite of an infected tick. So if a tick is infected with the bacteria Borrelia burgdorferi, it can transfer that bacteria to you, and then it's going to burrow into your skin and enters your bloodstream. So to be sure though, I want to perform a two-step test. Is that something you'd like to do today?
Well, tell us more about this test. How does it work?
Sure. So there's two blood tests that we do. So one's called the ELISA test, and then the other one is called the Western blot test. So the ELISA test is going to first detect antibodies or proteins specific for that bacteria that causes the Lyme's disease. And however, that test isn't always reliable, so we're going to use that Western blot test for a secondary diagnosis. And this is going to involve the use of electricity, so it splits your blood into these patterns. And then we compare that to the patterns of other people who are infected with Lyme's disease. So hopefully with these tests, we can figure out what's going on with you.
Okay. So now, what would happen if we decided the test was too expensive? Would he be okay without taking the test, or is that something we don't want to do?
I would not recommend hesitating any further.
Okay.
After the first stage symptoms, Lyme disease can develop into cardiac, neurological, and joint problems. And after a few years, it could get more serious, and you could get cranial paralysis or meningitis or arthritis. So
It's a lot for a 12-year-old.
That's a lot.
yes, that is a lot of horrible
Oh.
things, Lenny.
Hmm.
So these complications are all going to be a result of autoimmunity. So that means your antibodies are going to recognize your own tissue as foreign and start attacking it. So that causes severe inflammation, and that can cause really long-lasting pain in your joints and your nervous system.
That sounds horrible.
Yeah, we should probably get this test done right away.
So is this contagious? Like, is my dad gonna get anything if I just touch him?
No, not at all. Your father's completely safe.
Wow.
Don't
Okay.
worry.
I was getting
We're good
afraid to
there.
tuck Lenny in past couple of nights.
Yeah, don't worry about that. You're all
Okay.
good there. Okay,
Good
so
to hear.
sounds good. I'll just need to get a sample of your blood, Lenny, and we'll
Oh.
send it over for testing.
I mean, I hate needles, but
well,
We can do this,
gotta
son.
do it.
there you go.
Man.
Perfect. So I'm
So
going to send
That's
this
the
over.
worst thing in my life.
All right, we'll go send this over to the lab, and I'll be right back. Okay?
All right, thank you, Dr.
No
Ackerman.
problem. Hi, Lenny. Lenny's dad.
Hi.
So I'm back with the test results. So it looks like they came back negative. So of course that's what we'd want to be the case, but due to the rash that you have and the symptoms you've been experiencing, my team and I think your test is displaying faulty results. So sometimes a test like this can yield negative results even while you still have Lyme's disease.
Okay. So then, are you still able to treat Lenny for Lyme disease?
Well, at this point, no. I wouldn't be able to prescribe treatment for Lenny because he's not been diagnosed with Lyme's disease yet. However, I still believe this to be the case.
Sure. Do we need to see a specialist then, or what can we do now?
Well, it's funny you should ask. Due to Lenny's case, I called a colleague of mine who's specifically working on a new diagnostic test for Lyme's disease. His name is Dr. Wilkerson. Would you like me to page him?
Yeah, absolutely.
Yeah, that's fine.
Sure. Can I get Dr. Wilkerson to the doctor's office, please? Thank you.
Hi there, guys.
Hi.
My name is Dr. Wilkerson.
Hi.
Nice to meet you, Dr.
Lenny.
Wilkerson.
I'm 12.
Hello, young man. I'm from Columbia University. I'm leading a group of research scientists who are creating a new blood test. It can identify 8 different tick-borne pathogens, including the one most common from Lyme disease. It is relatively new, however, it only requires a single blood test and is much more reliable than the ones in the past.
Very cool.
Because it is relatively new and in the works, it will require a legal signing from Lenny's guardian.
Alright.
Is this something you're willing to consider?
Yeah, I'm willing to do anything to get Lenny running for Concordia again. I mean, I don't wear this shirt for nothing.
Raise him right.
That's right.
There you go.
Okay, I'll go ahead and sign this.
Alright, perfect.
Thank you.
Then Lenny will get his blood drawn once again, and then we should find out what is causing Lenny to be sick.
Perfect. Thank you so much, Dr.
Of
Wilkerson.
course.
Yeah.
Test now.
Yeah, I guess so.
Alright, so I'm gonna send this to the lab with Dr. Wilkerson, and he'll test this to determine if you've been exposed to any of those 8 different tick pathogens.
Yeah, I'm really hoping so because I'm kind of getting sick of these 2 blood tests I've taken. What are these tests even looking for?
Great question, Lenny. The test can discriminate against individual antibody responses in patients who have tick-borne diseases and further examines the disease's cause and progression. The test can also see how genetic diversity of tick-borne pathogens can affect a patient's immune response.
Okay. You know, I'm 12. I don't really know what that means, but it sounds kind of cool.
It is cool. You'll
yeah.
learn when you're older, so.
Hopefully. Hopefully that, I'm hoping that it can, the test can come back and show if I actually have Lyme disease or not.
Yeah, what's the time frame for a test like this?
The test shouldn't take longer than a few weeks. Hopefully by then we will for sure know what is causing Lenny's symptoms.
Okay, okay.
Yeah, so we'll give you a call, Lenny, when the test results come back, and then we can set up an appointment from there to make future decisions. So thanks so much for cooperating with us today.
Thank you,
We'll
Dr.
give you a
Ackman.
call in a few weeks.
Thank you, Dr. Wilkerson.
Of course.
Hi.
So
Good to see you again.
Yeah, good to see you again too. So I got your results back for the second test. Some good and bad news for you. So the good news is that we have discovered the cause of your rash and your other symptoms. The bad news is you've been diagnosed with Lyme's disease.
Sorry.
More good news though, you're in the early stage of the disease and we'll be able to treat you. And it's really good you didn't wait long to see me.
Huh. Who would have thought? Dinking around in the woods all these years, it comes to this.
I know.
So what's the treatment gonna look like now?
Well, Lenny, I'm going to prescribe you some oral antibiotics, specifically doxycycline. So you'll be on that for about 2 weeks, and then after that we'll check in with you again. You should be well on your way to feeling better and a full recovery.
Okay, that sounds awesome.
Awesome.
Yeah, so if you head toward the landing, keep going through the hall, you'll reach the pharmacy building, and you can pick up your prescription there.
Perfect. Thank you so
Awesome.
much, Dr.
Thank you.
Ackman, for
Yeah, no
helping us.
problem. It's a good day when I can help out a patient. Hope you
Awesome.
feel better.
Thank you.
Thank you
All
so
right,
much.
see you later.
Bye.